misty mountain.
Welcome to the Pride Perspectives radio show here on KSQD. Our topic tonight is National LGBTQ Plus Health Awareness Night, or Awareness Week. That's National LGBTQ Plus Health Awareness Week, and we're going to be talking about some experts in health in Santa Cruz County. My name is Rob Darrow. My pronouns are he, him, and his. Our Pride Perspectives radio show is here on KSQD every other Sunday from 5 to 6. You can find all the information about our show on the Santa Cruz Pride website at santacruzpride.org and on the KSQD website and wherever you find your podcasts. We record these shows so you can listen to them as you're driving to work later in the week or months ahead. We've got some great shows that we've done in the past, and we're happy to share another great one with you tonight. I'm here tonight with my co-host, Cece Pineros. How's it going, Cece?
Great, Rob. It's good to be here. Glad to see you today. And boy, a big thank you to Ned Hearn out there for being such a great sponsor of K-Squid in this show. We want to have you on our show one day. Anyway, my name is Cece Pinero. My pronouns are she, her. Our show is guided by the following beliefs. We believe that Santa Cruz County is thriving partly because of the contributions of LGBTQ plus people, and LGBTQ plus people in Santa Cruz County are thriving because of the broader Santa Cruz County. We believe in the words of Jewish poet Emma Lazarus that none of us are free until all of us are free.
On this show, you will hear us refer to queer history and LGBTQ plus history. For us, these terms are interchangeable and refer to people who identify as lesbian, gay, bisexual, transgender, anywhere on the gender identity spectrum, or who they are attracted to. All are welcome to be part of this radio show. So, Cece, you were here last time. I wasn't able to be here, but you were here with Linda Rosewood and the book A Circle Outside. What were some of the highlights of that one?
Yes, well, we had her on the phone. She read excerpts from her book. We had Colleen in the studio with us, and she sang, and it was just fabulous to hear Colleen's voice and to be, just in the studio with live music. And, Linda's book, A Circle Outside, they just had an event today.
Oh, I hope it went well. Yeah.
Yes, it was called, and the cool thing about that is we had Linda and Colleen talk about the book and talk about the Wonder in the Redwoods event that they had today. And in this week's Good Times, it just came out on Wednesday, was a big, huge picture of Linda and a whole expose about her and her book. And I'm like, we had her on our show first before it even came out in the Good Times.
Good for the Good Times.
Yeah, really good for the Good Times. So I was really excited about the big photo of Linda and all about the event, Wonder in the Redwoods. And we're just pretty excited that we got to advertise it. And I know it had a great turnout and they had a great event today.
I was listening to it on the KSQD app, which anybody can download and listen to past shows and listen to prior recordings. So that's kind of a cool opportunity anybody has with KSQD. But I love the part where you asked Linda how she knew that Santa Cruz was so lesbian, that you said the psychic hotline or something like that.
Yeah, the lesbian psychic hotline. Yeah. Is that how you heard about it? Because she said...
in the 1980s.
In the 1980s, I heard that Santa Cruz was a lesbian mecca, or that was the place to go meet lesbians. I'm like, where did you hear that from? The lesbian psychic hotline? And it's like, we don't know. And then we talked about the different, whatever, newspapers and things like that. It was certainly different in those days to meet people. And there was a magazine that still exists, and she talked about that, called The Lesbian Connection. And it is just the old-fashioned, I'd say, the old-fashioned internet. We had a magazine.
The newsletter?
The newsletter. It's free.
Yeah.
It doesn't have there's nobody that writes for it. It's all people write in saying, I have a free couch, or I need a place to stay, or I'm going here, or this event is happening. People just write in, somebody writes it up and sends it out. And there's no writers, there's no stories or anything. It's just community connecting with each other. What are your needs? What do you need? Or I have this to share, or I'm driving from I'm driving from San Francisco to New York. Who needs a ride to help pay for gas? All kinds of stuff that we did way back in the day to connect with each other.
Now, was that in Santa Cruz, Lesbian Connection?
I had the magazine. I had it mailed to my house.
You did?
Absolutely, yeah.
Did it have a brown cover on it to hide what it was?
That's right. Did it? I don't know.
I've heard about magazines in those days had brown covers, so
That's right.
people wouldn't see what was inside.
Especially those ones that the gay men ordered.
Oh, yeah, the gay men. But that's interesting about the Lesbian Connection because, one of the things that I've learned is how literate this community is, right? And even today, we're so literate, right? With this radio station, the other radio stations that exist in Santa Cruz, the variety of publications, both online. But in the olden days of the 70s and 80s, to know that there was a publication called Lesbian Connection, I'd not heard that before. I mean, I'd heard about the Matrix and some of those other ones. Yeah, because
you weren't tuned into the lesbian psychic hotline, I guess.
But I do remember Linda, the author, talking about how she read it in the City on the Hill Press. So I think the UCSC newspaper was probably something a lot more people read at the time than probably read today.
Oh, absolutely.
Because there probably was just the Santa Cruz Sentinel and that were print. And then whatever other people put on the thing. Oh, you said the Lesbian Connection was mailed to your house.
Yeah, it was it's a little magazine that's mailed to your house. And I think, UCSC, I think they were one of the first universities to have, an LGBTQ plus center on their campus, even though it wasn't called that then. It was probably called gay. I don't remember, but I know that Deb Abbott was the first person that
Deb's still around. That's another person we should have on our show.
Yeah, now it's called Cantu Queer Center. Yeah. So we should have Deb one day because that's definitely historic. And when UCSC, started doing that, then that gave way so other universities could have more inclusiveness.
Do you have any of those magazines still laying around, Lesbian Connection?
I don't, but I'll
But ask around. I would be interested. I've not heard of that publication, but obviously people received it and got information. It's another communication
and Linda
device,
said it's still out. She still gets it. You can get it mailed to your house. So we're gonna
still out.
Well, yeah, it's still
it must
happening.
be a national connection somehow.
It's still happening.
We've got to
we're just
look it
gonna
up.
have to look it up.
Learn
and
about the Lesbian Connection.
Get it sent to our houses. Exactly. We'll have to give Rob the secret handshake and the secret code, just like with Zoom.
If you're not a lesbian, I don't know if I can do that same handshake. Well, that's the good part of Santa Cruz County, that there were all these different groups operating in all those years, right?
Yeah.
And anyway, it sounds like that was a fascinating show. I mean, so the book, is there any key part of the book that we want to remind our audience listeners about that was kind of a nugget of information about the lesbian coven? And I mean, wasn't it in Bonnie Doon? Is that where it took place?
Yes. And she added things. Really, you really need to go to the bookshop Santa Cruz and buy that book.
Okay.
And or go online and get that book for sure. And speaking of bookshop Santa Cruz, they are doing from March 17th to March 31st, they're having trans author highlighting and a whole area for trans authors at Bookshop Santa Cruz to honor the Trans Day of Remembrance on March 31st. It's coming up on March 31st.
Wow, that's good to know. So that the show before, and I heard you talk about it on the last show about that. What was that date y'all got married? June
8th,
2008, was it?
Yeah.
Yeah. Anyway, so that was the other show. It was sure fun doing that show, and it was fun hearing you and Colleen talk about remembering those events and what was going on at the time and all the places that were going on. I mean, it must have just been. I mean, the area must have just been so electric of excitement and stuff. Well, could you describe a little more about what that was like?
Well, it was so fun because every time that we have gathered in front of the county courthouse, it's been to protest something that's been
recently for sure
against us. Oh, and for sure, and even back then. I mean, even back in the day, there's been so many different events that have been just protests against something instead of something positive for us. Like we're always fighting for our rights, and it seems like it's it's really unfortunate. And so this was like something that we were for, that was for us, that was benefiting everybody, and something so positive. Everybody was so happy. And like you said, yes, it was electric and so fun. And just to have everybody involved in the county building be so happy and excited about it. And it was just, an amazing fun day.
Now, did you all were you like in a long line and it was just kind of like you walked up and boom, you got married, then you walked out, or was it outside the courthouse or?
It seemed there was lines and there. It seemed like there was lines everywhere, and everybody was sort of crowd around so they could see that other person getting married. But there were different rooms, so they could have a whole bunch happening at the same time. Yeah.
But were the lines like out the door?
Yeah, and there were lines.
So if you drove by the county building at the time, you would have seen lots of people milling around outside.
Yes.
Okay.
Yes, there was
because I'm sure people then had parties after that or gatherings and stuff.
Yeah, and then there was either the next day or the week before, I can't remember exactly, but after it was legal, the Peace United Church up on High Street had mass gay weddings, and they had hundreds of people just line up like one by one in a row. It was really something. It was kind of like a prom,
right?
And everybody
Except
just
you
went
marched in and got married instead of
it's
go
like
dancing.
Two people walk up and the pastor there at the time said a couple words, said you're married, and they'd go and the next person would come, and it was just really fun to watch this whole line of people.
Wow, isn't that great the way our community stood up for that and really made it special? As we mentioned on that radio show, Dinah Phillips and Gail Groves were the first official couple to get married or same-sex couple when it was officially time to get married, but hundreds of people got married and obviously have that memory of that important day.
Oh, yeah. And some people went to San Francisco. I mean, San Francisco, I saw lots of pictures of that. That was amazing.
Yeah.
And because that building is so beautiful. It's really magical. Yeah.
Which building?
The
courthouse?
The city hall.
Oh, City Hall there.
Yeah,
right.
The city hall.
Yeah, that City Hall always looks good during Pride Month for sure.
Yeah.
Anyway, so that was that show. We've done lots of other great shows. Again, as we mentioned earlier, you can find them on our website, which includes podcasts of each one of these. I mean, before that, we had Sharon Papo and Kristen Brown talk about inclusive business and how important that is in Santa Cruz. We had that event called the Inclusive Business, LGBTQ Inclusiveness for Business People. And we must have had 40 or 50 people that showed up at Hotel Paradox to do a whole day, half day workshop to talk about what they can do to become more inclusive. And
that's so great. Did you get to go to that event?
Oh, yeah.
Oh,
yeah,
good.
I was there.
Good.
Yeah, Santa Cruz Pride and LGBTQ e-learning, which Sharon Papo runs, and the Diversity Center. The three of us put it on together. And then we had these great kind of partners with the Chamber of Commerce and with the Downtown Association and one other group. I'm suddenly forgetting who's the other person. Visit Santa Cruz was part of it, and I'll remember that other group. But it was a nice group of people that helped plan it and put it together.
And hope the listeners caught that Rob is part of a lot of things in this city and county. He was involved in that, organizing that business thing. I could go on and all the things, but I would like somebody like Rob to run for mayor of Santa Cruz because he's involved in all the right things. Especially you talk about business, like you were an organizer of that business, and that's an important part of Santa Cruz.
That'd be another. I was thinking about that driving over. Is that we have a number of mayor candidates. Maybe we could figure out who's the right candidate for mayor and the right candidate for governor, but we'll save that for another time.
Well, definitely we should, start with Santa Cruz for sure.
Yeah, for sure. The other event that happened Thursday night was the Warriors Pride Night, and that was really exciting. I don't know if you've been at that in the past. I've been at many of them now because of this partnership with the Warriors. But they did a great job decorating it. They had sidewalk art out there, and then Patty Maxine, a musician in our town, played the national anthem on her steel string guitar, which was really unique. She said, everybody knows the words. Let me just play the tune rather than singing the words. So she did. It was very impactful, her sitting there. And then at one of the breaks, they did a Community Heroes Award, and they gave that award to Ash Imor, who is a trans student who's on the County Office of Education Board of Education, the
Oh,
student
good.
rep. And it was great to have Ash there to have that honor, and just to thank the Warriors for, standing up and celebrating, our community and the LGBTQ plus community. We, at this point in time, we can't be too visible, right?
That's right. It's very important. It's really, that's so good to have sports teams on our side
Yeah,
too.
right.
For sure.
Yeah, so they did a great job of celebrating that, and Ash got to cut down the basket at the end and got it as a souvenir. And we had a group photo. Oh,
that's
that
so
reminds me.
good.
I'm thinking, where are those group photos? I gotta find where those are and get them posted. That's the challenge. Is you do these events and you all take pictures,
Right.
and then you move on to the next event. And you go, oh wait, it would have been good to post that photo, but there were about 20 or 30 people from the LGBTQ.
We don't know. When do you ever sleep?
Yeah. The funny part of that statement you just made was when I was working full time, other events kind of planned out my calendar. I was a teacher for many years. So, it was always based on the school calendar of what was going on and who was talking or what class I had to teach. And then I retire from all that. And now I'm having to plan out in advance even more. I can't just wake up one day and say, oh, we're going to do this tomorrow, because there's all these other people that are involved. So that's what I've learned, quote, in my retired life, the importance of planning in advance and to create that space for people to do that. So.
See, and those are good questions we should ask our politicians when we have all the politicians on. See why I think Rob would be a good mayor of Santa Cruz.
Oh, right.
Back to that again. And Pride Night, it'd be free tickets for everybody.
Yeah, right. Well, I will say, but you brought up the mayors, and Mayor Fred Keeley has certainly been a great supporter over the years, as many city council members, as all the board of supervisors. Oh, in fact,
but we haven't had a gay mayor since John Laird, and that was I
that's
won't
true.
even say how long ago that was.
Well, and it was an automatic thing that they rotated around city council members, right?
Right.
At that point. So everybody who wanted to be mayor eventually became the mayor. But, because the city of Santa Cruz has only had this elected mayor since they voted for it. And
yeah, Fred was the first one.
Just as an aside, I don't live in the city
Yeah.
of Santa Cruz,
Yeah.
so I would not be eligible to run for mayor. And I won't be voting in the election, obviously.
Well, and that seems to be the state of the affairs of all the political offices. The right people don't live in the right area, right?
Well, that's very kind of you to
There
say
you go.
that. But since we're talking about voting, we should say to people, if they're not registered to vote, they could still register to vote. And the primary elections in June, the first Tuesday in June, we'll tell you about that after the break. But if everybody should plan to vote.
Is that the 8th?
No, June 8th is Pride. That's the Pride Parade and Festival. But the Tuesday before it is the primary election. So people should get that on their calendars
Tuesday
to make
before
sure
Pride.
they
There you
vote.
go. Get out
The
to
Tuesday
vote.
before Pride, for sure. So our show tonight is going to focus on National LGBTQ plus Health Awareness Week. This I didn't know this before, but it's the 24th annual LGBTQ plus Health Awareness Week, which takes place always in the middle of March. Did you know about this? Had you ever heard of it?
No, I didn't.
I didn't either. Yeah. So this year's theme is Organized to Outlast, and it calls on the LGBTQ plus community and those who provide health care to organize for LGBTQ health against the regressive forces of policy and culture. We know that those policies change and funding ebbs and flows, but what remains is that inclusive and affirming health care is needed for everyone and for members of the LGBTQ plus community. And I would add, especially for transgender people. We read every day about another law being passed against trans people or withholding gender affirming care for transgender people. And to me, that's just criminal in itself. So anyway, right.
It's important to note our laws in California.
That's right. Our laws cover all that. So
our California law prohibits health plans from denying health care or discriminating against individuals because of their individual gender, including gender identity or gender expression. And in 2023, California implemented the Transgender, Diverse, and Intersex Inclusive Care Act, which protects the right of Californians to access gender-affirming healthcare services. So...
yeah, it's important for us to know that those laws protect all of us, and especially transgender and gender diverse and intersex people, that those laws are still in place regardless of what the next executive order might be.
Well,
what
and
they
that's
do,
like,
right?
and that's our whole philosophy is none of us are free till all of us are free.
Absolutely.
So all of this has to do with all of us because, you know, they come for the trans and I wasn't trans, so I didn't stand up.
Yep, exactly.
They came for the men and I wasn't a man, I didn't stand up. Not that that would happen. I should say gay men, right?
Right.
That whole philosophy. And then they came for me and there's nobody left to stand
Right.
up. So we have to stand up for all of our oppressed brothers and sisters and groups.
Right, and all the cultures in Santa Cruz County, we
Yeah.
all stand up for each
Well,
other.
and, you know, most recently, you know, Jesse Jackson most recently passed away. And I remember Jesse Jackson, he had the Rainbow Coalition.
Right.
Jesse Jackson had the Rainbow Coalition before the LGBTQ plus community ever
Yeah.
thought about being the rainbow, which is about being inclusive to every single person under
Yeah.
the rainbow, right?
Yeah, I think the other thing just to point out to people is from the Santa Cruz Pride perspective that different health organizations, Center Health and Dignity Health, have all been sponsors of our annual Pride Parade and Festival. And they continue, from what I can tell, to be supportive of all of our groups. And despite these laws, we know that gender affirming care is being reduced or eliminated by different health systems, but not as much here in Santa Cruz County, at least not that I'm aware of. So I think it's important for people to know that in California, there's the California Department of Mental Health that monitors the health for LGBTQ plus people and other people. Their website is the California Department of Public Health. In Santa Cruz County, the County Health Agency monitors the mental and physical health of all people, and in particular, the LGBTQ plus people. Their website is santacruzhealth.org, and we're going to have a couple of people who work there talk about that tonight.
Well, hello, we're back. This is Cece Pinero. You're here listening to Pride Perspectives radio show. Welcome back to Pride Perspectives. So today we're talking about the National LGBTQ plus Health Awareness Week, and our guests are people who work in Santa Cruz County Health Services Agency and Public Health. Karissa LeClair-Cortez, County Health Director, County Deputy Health Officer, and Nancy Willard, Health Service Manager. Welcome, Carissa and Nancy. Carissa, we're going to start with you. Welcome.
Thanks so much. Thanks for having me here.
Yeah, so we're going to chat with you first. And as always, we like to get to know our guests before we get into all of your work stuff. So can you share a little bit about your background and where you grew up?
Absolutely. I'm actually originally from the East Coast in the New England area. My mom and her family actually immigrated there in the 60s. They were coming from Ciudad Juarez in Mexico, and they actually came for factory jobs in the area. So that's where I was born and where I grew up. My dad unfortunately passed away about 10 years ago, but he worked in construction. So for that reason, we moved quite a bit within the area. So I was born in Massachusetts. Since then, I lived in Maine, New Hampshire, Vermont. I know you Californian folks probably don't even know that those are states, but they are, and I lived there. So growing up, I always kind of felt like we were the only Mexican people in the area where we lived, which is probably not totally true, but it certainly felt that way. So that's something that I really love about living here. I now live down in Watsonville, and I really love just feeling like a part of the Latino community. Otherwise, I've got one brother. He also works in construction. And he and my mom both live in Maine, which is a shame to be far away from family, but thankfully it's a nice place for them to come visit out here.
That's so great. Well, of course we know Vermont because Vermont had gay marriage, so I know Vermont exists.
Yeah, Vermont,
long
a great
before
growth
anybody
state.
else, right?
Yeah.
So, or other states. So what was your early education like? And then when and what did you do when you went to college? So talk about early education, then talk about college.
My early education was pretty good. I've always been kind of a curious kid, so I did enjoy my school. I stayed pretty local for college. I went to Boston College, and I studied biology and actually did a minor in studio art. Being totally honest, I think I chose the bio major just because it seemed like the most straightforward, easiest one to do as a pre-med. I think if I could go back and do it again, I'd probably do something that I'm actually more interested in, probably something in the humanities. Thankfully, now that I've finished up my medical training, I actually have time to just learn for fun, so I now get the chance to kind of learn things that I'm interested in just for the sake of being curious.
That's great. Like what? Tell me. What are you interested in? What are you interested in learning now?
Well, I continue to be blown away by California and just all of the nature and plants that are here. When I moved here about 4 years ago, I just was totally struck by all the trees and plants, and I really nerded out trying to learn all of that stuff, and recently moved to an area where there's a lot of nature here, both good and bad, like the poison oaks and poison hemlocks of the world. So I've really gone down a rabbit hole recently learning about all the local flora and fauna, and I have a pretty good time, and also probably annoy my friends and family whenever we go on a hike, because I'm like, this is this, this is this. So if you ever want an educational person out there, I do know a little bit, and I've tried to teach myself about some of the nature stuff.
Well, that's
before we leave that education section, could you talk a little bit about the degrees that you have?
Of course, yeah. So I have a medical degree, which I did I was at Dartmouth for medical school, and then I also have a master's of public health, which I did at UC Berkeley, and that was something that I did in part with my preventive medicine residency, which is a kind of a black sheep residency. Many people don't know about it, but it is, I think, a really awesome training for doctors who want to not just be limited to caring for individual patients, but want to look at the broader level of public health and the community and all of these systems that shape people's health. So that's where my training has kind of brought me here to Santa Cruz.
Wow, preventative medicine. So not to get off the topic, but I bet you could have told us COVID was coming back there in 2020.
Well, yeah, I was actually in med school back then, so I was still learning a lot of stuff, but I am thankful to not have. It seems like the folks that were in the field really went through a rough time during that patch, and I think that I have a lot to learn from the lessons that we learned from the pandemic.
Yes. Well said. So tell me about what was your first official job, or your first official jobs?
Great question. Yeah, so like I mentioned, I'm from New England. So a funny thing about New England is that Dunkin' Donuts is like religion there. It's not really good coffee, but for some reason people have this really strong loyalty to the place. So in true New England fashion, my first job was at Dunkin' Donuts when I was a teenager. And totally honest, it was the worst job that I've ever had. I thought that the free coffee and donuts would be totally worth it, but the truth is just that service workers are treated so poorly. And of course that's true to this day, and something that I care really strongly about is protecting the health of workers, which I think is directly tied to their working conditions. So sorry to turn that question into a soapbox, but I think that worker health is important and very much related to the job that I do.
Absolutely. And then what else did you go on from Dunkin' Donuts?
What was next?
Yeah, what was next? You didn't just go right to be
got my medical degree
there,
and went back to Dunkin' Donuts.
No, after that, I worked throughout college. I again worked in food service in some of the dining hall locations, which was a slightly better experience. And then from there, following college, I worked for a little bit as an EMT locally back in Maine, and kind of got a little bit of healthcare exposure and experience from that.
Yeah, I bet. Then what's next? What? Tell us the progression. So then,
and then how did you end up in Santa Cruz?
Yeah, because that was the next question: is how did you end up in Santa Cruz? It must have been a work thing, or?
Yes, I came out to California for my medical residency, which, like I mentioned, I did it through UC Davis and the California Department of Public Health.
Yay, UC Davis.
Yes,
yay.
Go Aggies.
Go Aggies.
Because of my background, I really wanted to work in a place where I could serve the Latino community, and I particularly had a really strong interest in farm worker health. So that's what drew me out here to California. And the second and third years of my residency were sort of an apprenticeship model, so we get paired up with a local public health officer. And I was paired with Dr. Lisa Hernandez, who was working in Berkeley at the time. So shortly after we started working together, she came to me and she was like, I'm so sorry, I just accepted a job working for Santa Cruz County. I would love to keep working together, but I know that you live here. And I was living in the Bay Area at the time. I think she was probably pretty surprised when I was like, sweet, we're moving to Santa Cruz. I totally love working with Dr. Hernandez, and she's still our Santa Cruz County Health Officer, who I work really closely with. And also, I was really excited to get to work in a county with such a big community of farm workers, which to this day is really a big part of my job. So I came here as part of my residency, and I was really lucky that they had the ability to hire me on as a full-time deputy health officer once I finished up my training.
Wow. Well, thank you so much for your service. Thank you for all you do. I'm one of those people that was born here in Santa Cruz, and I'm apologize. I don't remember exactly what year, but it was sometime between 1980 and 1985, maybe. I don't think it was the 70s. We had this huge epidemic of migrant farm workers becoming heroin addicts because they couldn't get access to medical care for their injuries or their back, like really the bad backs. If you ever pick strawberries, you know your back's going to go out in like 2 minutes. And it was this huge thing, and I don't know if people remember it or if there's anybody around, but it was really apparent that we needed to have health care for the people that were picking our food and feeding us, and they had no access, and the drug dealers were taking advantage of them, going, here, try this, because it did work, but then they got addicted to it and it became this whole problem. And then anyway, that's my story that I heard, that I really admire and appreciate any healthcare workers that go in to help our farm workers, because it's really an important thing. So thank you.
Absolutely.
So what caused you to learn more about serving the health needs of the LGBTQ plus community and people?
Yeah. Starting off, I do personally identify as queer, so of course that informs how I approach this work. I think my first formal introduction to queer-focused healthcare was again during my residency. I did some rotations at the UC Berkeley Student Health Center. And of course, no organization's perfect, but I did have a really good experience there. They have a really robust system for queer healthcare. So while I was working there, I learned how to provide gender-affirming care and really how to be trauma-informed in caring for our community. This is a really important jumping-off point for me, and I do still think that accessible, safe healthcare is crucial for queer people. However, part of this public health job, like I mentioned, is realizing that a lot of what keeps people healthy happens outside of the healthcare setting. So I do also try to keep focus as well on the bigger picture of how we structure our communities and our policies and how we can use those to protect the health of queer people.
Wow, that's great. We could talk all night with you, but we've got another person here we need to talk to. So Nancy Willard, it's great to have you on our show as well. You and I have known each other. I looked it up since 2018 when we were involved with a community foundation grant that brought together a cohort of teachers to learn about comprehensive sex ed. So that was 8 years ago. It's funny how we blink our eyes and time flies, but I've always known you to be part of the Santa Cruz County Public Health Department. So how are you today? And can you start by sharing a little bit about your background and how you ended up in Santa Cruz?
Sure. Yeah, it's great to be here. Thanks for having us on. So let's see, how I got to Santa Cruz actually is related to my education. So actually I came here for college. I went to UC Santa Cruz. And I did my undergraduate in social psychology and education, and then actually stuck around for a few years, like people do, until I discovered the field of public health, and then actually left and came back. But when I left, I went to go to grad school for my public health degree.
And then, so what were some of your first jobs?
Yeah, so so y'all provided these questions to us ahead of time. And when I looked at the word official job, I actually was like, what's my first official public health job? So I could tell stories like
Dunkin' Donuts. Was that your first one?
No, it wasn't Dunkin' Donuts. My dad actually had a feed store. And so I worked in a feed store when I was a teenager. And that was a very educational experience in itself. Yeah. But yeah, so for my public health degree, my master's degree, I went to the University of Michigan. And so, and when I graduated, I actually graduated like right when the market crashed in 2008, 2009. So I stayed there and did kind of my first public health work there. So several jobs. I led a community health worker program through a safety net clinic. I was part of a research team working on using technology to bolster people's natural social support systems to manage chronic disease. And then I was part of another research team, and this one developed web-based and phone-based and app-based interventions, and I was one of their health writers. that was all before I came back to Santa Cruz.
So you came here for school, then went away for your advanced degree, and then came back again, huh?
Yes, and I intended to come back, or at least to California right after, but because of everything that was happening with the economy, you just never know what life is going to throw your way. And actually, for so many reasons, it was really good to be there. I ended up being there for 7 years, and it's an education to live in a different part of the country, and so I am grateful for that experience.
Yeah, that's great. So, we're talking about the fact that it's LGBTQ plus Mental Health Week, and I'm curious for you, what has caused you to learn more about serving the health needs of LGBTQ plus people?
Sure. So similar to Karissa, I identify as queer myself, so that's motivating. Also, I have a young family member who I'm incredibly close to, who came out as gender expansive actually when they were just 5 years old, and entered the public school system in kindergarten, and is helping this precious kiddo navigate school systems and healthcare and all of these contexts in life. And it really just brought into stark relief the gaps that still exist even in kind of liberal, inclusive communities similar to our own. So, I had known this intellectually and professionally, but it's such a different thing when it's that personal.
Right.
And it makes the work deeply personal and really integrates my values and my commitments to those I love and, my team, community members and all.
Well, and then in your training, Karissa talked about, she worked directly with an LGBTQ plus medical outreach team or something like that. Was there anything like that in your education, or is your learning been more being here in Santa Cruz and interacting with the LGBTQ plus community?
I will say inherent in any public health program, we are educated about, health disparities and the social drivers of health. So those things that make it more or less likely that someone will have greater access to health. And certainly, as we all know, the experience of living with stigma or discrimination are such a huge influence for people's health and, competent and accessible healthcare and all of the pieces that y'all were talking about, before the break. So those were all integrated in my degree program, and also thinking about kind of all different groups and how folks experience health based on the different pieces of their identities. So that was integral to my education. And then, as you know from our work together, my work integrates serving the LGBTQ plus community here.
Great. So let's move into what the Santa Cruz County Health Department, I saw Health Services Agency and Health Department. I'm not sure which is the right term these days, but maybe one of you can tell us what we should be calling your organization and then the different departments. And then could you talk a little bit about the services you provide?
I'm happy to start with that question. So yes, I am new to government, and there are a lot of departments and divisions, and it's all confusing. But to my best understanding, there's the County of Santa Cruz, and under the County of Santa Cruz, there's the Health Services Agency, which is one of the biggest departments that lives under there. And under Health Services Agency is the Division of Public Health, in which Nancy and I both work. Also in that agency, there are other programs for environmental health, behavioral health, health center clinics. And so I think what we can speak to is specifically what happens in public health and a little bit of my interactions with the health centers, but just recognizing that there are a number of other really wonderful folks that are doing holistic care kind of across all of those entities there. But in terms of the services that we provide for queer folks in the county, I like to just say ahead of time that we can't consider or treat queer people as an other and separate them from our regular services, right? Queer folks still need to get their colonoscopies, Trans people should still have access to free helmets for wearing on their bikes. And so we really care a lot about making sure all of our services are accessible, safe spaces for all members of the community.
Right.
And being totally honest, we're probably still not perfect at that, but I can say that there's a lot of folks in the organization who are really striving towards that goal. In terms of LGBTQ-focused services, I can talk about some of the things that I've been involved with. So we've been making a focused effort in the past year on HIV prevention, and especially for queer people. Thankfully, there are a lot of options these days for people to protect themselves from HIV. So this includes PrEP, which stands for pre-exposure prophylaxis, which is a medication. It can come either as a pill or an injection that people can take to reduce their chances of getting HIV. And I think less well known is a medication called PEP, which stands for post-exposure prophylaxis. And this is something that people can take within 72 hours of an unprotected encounter with somebody who either you know has HIV or an unknown HIV status. These are really good prevention strategies, but we know that they're underprescribed. People sometimes don't know about them, and they might have difficulty accessing these medications. And these are barriers that we're working to address. So just as an example, we are directly working with healthcare clinics to improve their workflows and to educate providers on PrEP and PEP. An example, PrEP used to really only be prescribed for cis men who have sex with men. But we now know that actually a broader group of people can benefit from taking PrEP. So we're working to ensure that local providers are up to date and know these changes.
So it sounds like you, I was going to say, it sounds like you educate the local medical group of people, doctors and other nurses and things like that. I'm curious what you do to help the broader population or other young people or even middle-aged people know about these services or know about the changing medical stuff.
You took the words right out of my mouth, Rob. I was just going to say we also do work directly with individual folks, either if they have to get connected to PrEP or PEP or if people have difficulty paying for the meds. And there's now a number of coverage programs and a lot of options to get these meds for free. So we actually have PrEP and PEP navigators within our programs that people can call directly and who can actually help people get access with this, find out what the appropriate medication might be, or get linked to a healthcare provider. And then lastly, we are also working on a number of social media campaigns to directly educate the community about PrEP. So we're actually going to be sharing some educational ads on dating sites, and we've actually done some videos and education on other social media sites. So if you check out the County of Santa Cruz social media, I know there's a video of me sharing some of this information in English and Spanish that will be shared sometime soon. So sorry for making this a self-promotion. I also want to hand it over to Nancy, who can talk about some of our other services.
Go ahead, Nancy.
Great.
Sure. Yeah. So I'll say for me, the unit that I manage is called Youth Empowerment and Action for Health. And so the majority of the work that we do is focused on adolescents, so really kind of from preteens through maybe mid-20s is kind of what we consider the full scope of adolescence. So most of our work is focused on that population, but we do have some work that spans beyond. And our work is really focused on kind of what I like to call sort of sex, drugs, and rock and roll, what is like really relevant to youth. So we're looking at sexual and reproductive health, promotion, substance use disorder prevention, which includes promotion of mental health and behavioral health. And so those are kind of the topics that we're focused on. And so within that scope, one of the programs that I have is called Friday Night Live. It's run by Maggie McGonigal, who is an expert, and her team. They're phenomenal folks at Youth Adult Partnership, which is this really great model where we use some tools to explicitly share power with youth to make changes in their own community. So it builds capacity for youth to be active leaders and resources for their own communities. And it involves social and emotional learning and healing and centered engagement. So the youth are leading the change that improves the context of their own lives. And we have a queer youth council that is in partnership with a diversity center. So these are middle school age youth who choose to be part of this work, and they get the chance to say, okay, these are the things within our community that are barriers to our experience of having a healthy or, safe or enjoyable life. And we help those youth, or my team actually helps those youth to learn about the systems that they can change to make the context of their lives better. So for example, in a different chapter Youth at another high school were working on a hate speech project in which they were noticing that there was a lot of hate speech going on at the high school, and the school wasn't really kind of following their own policies or really supporting youth the best way that they could. So those youth were working on actually policy changes and working with the leaders in their school system. So yeah, we're really excited to be working with the Diversity Center for this particular youth council.
So I'm just curious, if a person or young person is worried that they might have contracted HIV or an STI, could they call your office and get guidance? Or how does a person deal with something like that where they're maybe a little afraid?
Sure, yeah. So that would be in the scope of a different program in my unit. It's teen health outreach. And yes, so one of the things that teen health outreach does is help youth get access to care, so doing linkage to care. And I think many folks know, but maybe not everybody, but that in the state of California, youth ages 12 and older have the legal right to access confidential services, which include sexual and reproductive health care, mental and behavioral health care, without needing to have a parent or guardian consent for them. So if there's something going on, and if they feel like of course, we always want for youth to be strengthening their relationships with the adults in their lives, and and having the support of their parents and guardians in accessing care. But sometimes people will be in a situation in which they don't feel like they can talk about it for whatever reason, whether it's a safety issue or there's stigma, or they don't feel like they can talk about it. And so having these laws in place makes it possible for youth to still get the care that they need without having to ask a parent or guardian to help them to get it. And so people can reach out to our team at Teen Health Outreach, and we do have a website. Folks can Google that, and our team will help youth. We do things like we'll actually get on a 3-way call with a clinic and help set up appointments. We'll talk with youth about what their experience is, what's going on for them, what support they may need, what care they may need, and just kind of help them to navigate the system.
On that Teen Health Outreach website, is there also a phone number somebody could call if they wanted to?
Yes.
Okay.
I should
great.
have that in
Oh
front
no,
of me,
you don't need it.
but,
I just wanted to
out.
make sure that people listening to this knew that that this is part of the services that you all provide that is so important. So
yes.
Yeah, great. Thank you.
And
yes, and
so,
that team is led by Jasmine Jauregui, and Mariela Renteria is one of who's known so well in our community by many youth, and I'll tell you, so many youth call Mariela to get support in this area. So I will say she's really well trusted and is really approachable.
So my question, Nancy, was, so how in these teen projects or programs, how do you guys interface with the schools and school districts to provide this, to make sure that there's health and health training and support? Do you interface in any that way, or how do you get support for health education in schools? Do you guys do any of that?
Yeah, we do. Yes. So there's kind of 2 different pathways that we do. One is that we actually provide that direct service ourselves. So we'll go in and help a school if they don't have capacity to do it, and I can talk about that in a minute. But when you talk about making sure that a school is sort of following the law, so actually in the state of California, the California Healthy Youth Act requires that all middle and high schools provide at least one time, so usually in 8th grade and maybe freshman year at least, and they can do more, which is great if they do, comprehensive, medically accurate, inclusive sex education. And so actually, Rob, you were referring to the project that we worked on several years ago, and there was funding from kind of some different sources that supported this. We had some STD branch out of the California Department of Public Health funds that we used several years ago to launch the Comprehensive Sex Education Network. Mm-hmm. Here in Santa Cruz County, right, in partnership with Karissa Services and Safe Schools Project and a local curriculum developer and educator, Jamie Cutter. And we brought together teachers and administrators to offer training about California laws and best practices in teaching sex education, linking youth to confidential health care, and more. And as we know, funding is much more scarce these days. And so we haven't been able to fiscally support the Comprehensive Sex Education Network, but it continues to thrive, and via the leadership of Karissa Services and Jamie, and we are active participants in that coalition. So I think we're really lucky to have that strong resource in our community.
So this is And then what about mental health services? So we've got just have a few minutes. Could one of you talk about the mental health services, and if a child is having mental health crisis, what they might do, or an adult for that matter, and especially LGBTQ plus adults. And then think about any final words you'd like to leave everybody with tonight.
Sure. Yeah. So for folks that are needing access to mental health care, well, first of all, if folks are in a crisis, we know that you can call 988. That's the most easy to remember, and it's just sort of like dialing 911. But if somebody is having, a moment of crisis around mental or behavioral health, that's a number that folks can call. It doesn't actually have to be the person themselves that calls. It can be somebody who cares about them, who's looking for some guidance and support around how to help that person. And that puts them in a position where if there are emergency responders that need to respond, it's not going to be treated like a crime. They're going to be able to get a crisis response team who are trained in serving folks with a mental health emergency. And then on the side of just sort of, folks that just know they need care, like I said, for youth, mental and behavioral health care is a confidential service. So in the state of California, they can get access to that care without needing parental or guardian consent. And our team can also link youth to that kind of care. On the county's website, there's a mental health pocket guide that people can look up and see all the places where there are mental health care services, whether that's crisis support or ongoing mental health support. And of course, our Diversity Center provides mental and behavioral health care for folks free of charge.
So that you've just got a tremendous array of services for people of all ages, which is just amazing. I wonder if each of you could just take a minute to kind of close out your section here to say what's the key message of the space within you where you work in the county public health department. What's the most important thing you'd like to leave people with? Nancy, why don't you finish that out, and then Karissa, you can finish out our segment.
Sure. I mean, I'm going to just focus on youth, and then I'll let Karissa kind of speak to the broader picture of everybody in the community. I think now, as we know, youth are experiencing a lot of challenges, but they also are a source of being able to be part of the solution, and that we need to remember that there are ways for us to honor the experiences and the expertise and the knowledge that youth can bring to the table. And so I think a lot of people will talk about sort of the mental health crisis or sort of what's happening for youth now. And I think it's really important to remember that the best thing that we can do is include them in being part of the solution, because that in itself is healing, to be able to be part of the solution.
Thank you.
So, yeah.
Karissa, your final thoughts?
Yeah, I can hop in here. I just like to kind of orient and remind ourselves of kind of what we mean when we talk about striving for queer health. And I didn't come up with this, but I really like the definition that describes health as physical, mental, and social well-being. So, for example, not just having access to hormone therapy, but also being in a safe, supportive community where queer folks can thrive. And in my mind, these things aren't separate. So I think all of the organizing that's being done in the community, in building solidarity and fighting for liberation, that's crucial to queer health. And vice versa, us as healthcare providers need to fight for these causes as much, if not more, than we do for people's access to healthcare.
Wonderful. So we appreciate both of you being here to help us celebrate National LGBTQ plus Health Awareness Week. And everybody should remember that number. I did not know that, 988, a very important number. So thanks again for being here, and I look forward to seeing you at future events. We have got a few minutes left to talk about our upcoming events, and one of those events is March 31st is Trans Day of Visibility. And Cece, you were talking about what Bookshop Santa Cruz is doing, but could you talk about that a little bit more so people get this for our final wrap-up here?
Bookshop Santa Cruz is having started on March 17th. It goes to the 31st, and they're having a trans rights readathon. And they are featuring authors that are trans, non-binary, two-spirit, gender non-confirming authors and characters of these books. So please go down to Bookshop Santa Cruz and
check it out.
Check it out.
Nice.
Check it out. Yes.
Good to know from then. So the other thing happening in Santa Cruz coming up April 16th to 26th is the Santa Cruz Ripple Arts Festival that will include all sorts of visual and performing arts, music, dancing. Check out the schedule on Ripple Arts Fest website. I bring that up because in April we're going to talk to different performers involved with that, and visual performers and visual arts and some painters. All that's coming up in our show in April. And then mark this on your calendar now. June 7th is the annual Pride Parade and Festival. It's time to register if you want to be in that parade or have a festival booth. The county health department's always got a number of booths there, so we're looking forward to seeing you there. We're also looking for entertainers to be on our Pride stages, so all of those things can be found on our website. All these shows are recorded, so if you miss one, you can check out our website. Thanks again for listening to Pride Perspectives, conversations and stories to celebrate the LGBTQ plus culture and history across Santa Cruz and Monterey counties.
Up the misty mountain, wildflowers